Hi, my name is Alyssa Fitzgerald, and I am a senior at Sam Houston State University, and I am finishing up my internship at Memorial Hermann, a sports medicine and rehabilitation clinic, the Pearland East location. At my clinic, we offer a variety of different things. We offer concussion therapy, dry needling, hand therapy, ISDM, better known as scraping, neurological rehabilitation, occupational therapy, physical therapy, pre and postnatal therapy. We have return to work programs. We also use the Schroth method, which is for scoliosis patients. We offer sports specific therapy, and we also offer vestibular management. Now, not every PT in our clinic offers each one of these. For example, only 2 of our 5 physical therapists offer dry needling, and only 1 of our therapists offer or specialize in the Schroth method for scoliosis patients. My personal supervisor for my internship, her name is Kathy Nguyen, and she is an outreach athletic trainer who works basically as a PT tech in the clinic. So what she does is she helps the physical therapists with guiding their patients through their rehabilitation program. That's the word I'm looking for. And will just kind of help keep the clinic running smoothly during each hour. She also works as an athletic trainer at 2 of the junior highs. So she works at Pearland Junior High East and Pearland Junior High West as the athletic trainer there. I personally did not get to see her working through those specific locations because I was her intern at the Memorial Hermann location. So for my specific job duties, I basically worked right alongside her. In the very beginning, I was just working with her, seeing what she did throughout the day, helping her. She was teaching me how to work with patients, how to be comfortable in working with patients. I was very nervous and very scared when I first started. And she kind of just gave me that push that, like, it's okay, like, be confident in yourself, like, you can do this. And the more I started to get comfortable in myself and my abilities, the more I was able to work more independently rather than shadowing her all day. I was able to work as like a PT tech myself. Excuse me. So my specific job duties included, like, every hour we wipe down tables, we use Santa Cloth wipes to sanitize tables and equipment we use. We have dumbbells, we have kettlebells, we have TheraBands, anything and everything that a patient may have touched within that hour, we're wiping it down. From there, when new patients come in, some of the PTs would ask us, hey, can you go get so-and-so started warming up on the recumbent bike, or we had a treadmill, or we had an elliptical in the clinic. So that was just kind of what started off the hour. Then as the hour moved on, a PT would come up to me and say, hey, will you run through this, and this, whether it be putting them on the leg press, having them do sidestepping, leg kicks, bridges. I mean, we had a variety of different exercises that we used for each different patient, and each physical therapist had a specific program written out for each patient, so it just depended on what they were there for and what the physical therapist wanted them to do. So I got to learn a lot through that because I was not very confident in my abilities to be able to know the exercises or know what was appropriate, but towards the end of my internship, I was able to follow the protocol very independently without having to constantly go and ask the PT what was next. Some of the things that I learned the most was really I just learned a lot about myself and my capabilities. I've never had the opportunity to work one-on-one with a patient before I came here, and now that I can actually say that I know that I can do that. I also learned a lot from each individual physical therapist that I worked with. They were very kind and had allowed me to constantly ask questions about what they were doing, why they were doing it. I learned more about dry needling, why they do it, how they do it. KT tape was another big thing that I learned about that we used a lot in the clinic. And so overall, I would say my experience was really great. I think that my site was a perfect site for someone who was looking into going into physical therapy school, and I could also see it being a great site for someone looking to go to occupational therapy school. Unfortunately for me, we did not currently have an occupational therapy on site during my internship, but I have been told that they normally do have an occupational therapist and that they will have one. Anyway, so that was just a little brief overview of my internship. I've learned quite a lot, and if you ever choose to do your internship at a Memorial Hermann Clinic, I hope that you learned just as much as I did. Thank you for watching. Bye.